Welcome everyone to the Plastic Surgery Revolution. Your host again, Dr. Stephen Davis, and I actually have a very special guest with me. Today I have Julie Bass Kaplan. She is a nurse practitioner from Northern California, and she's been running her own business since 1999.
Yeah, since the early days.
Disappearing Act, laser and injectables.
Yes.
Both,
Yeah,
right?
we do both.
Both.
Yeah.
So Julie, and by the way, she has one of the most incredible followings on Instagram, right? I mean, how many people are we talking about now?
Maybe 31K or so.
That's a lot.
Yeah,
you
and
know?
mostly injectors, but a lot of patients too. But,
Right.
Yeah.
So Julie and I are at a meeting in California, and here we really start to innovate a lot of things that we're going to end up teaching doctors and nurses for the rest of the coming years.
Mm-hmm.
But one of the things I really love about Julie, and when we talk about things, she has this incredible way of connecting with not only people she's teaching how to inject, but she has an incredible way of teaching her patients about all the new modalities and therapies that are available. And that's why I wanted to talk with Julie about stuff. So Julie, a couple of things. Like when someone's coming in to see you, how do you take enough time in the consultation to really alert them about all the different things that are out there to potentially fix something that has a multitude number of ways of fixing it? Because I know I find that to be an issue in my practice. How do you go about doing that?
It is a challenge, right?
Yeah.
I kind of think if somebody comes in and they're new to me, I've never met them before, I like to first establish a relationship. Instead of just standing up and start going off on what's wrong with their face or their appearance,
Right.
I like to sit
It's
down.
always a good thing, right?
Yeah, it's good.
You want to make sure about that.
Sit down next to them like we are, instead of standing up and they're sitting. Just sit down eye to eye, connect with them, kind of get a feel for what kind of person they are, what their personality type is. I also, we do paper charting, so I look at their handwriting. I think I took a course in handwriting analysis.
Oh, that's so smart.
I know.
God, that's
when
a
I was
smart
pregnant,
thing.
Yeah, when I was pregnant with my first son, I had nothing else to do but stay home and be pregnant.
Right.
So I took this graphology course, but I'm
Smart.
really the first consultation. I'm getting a read on them, what's important to them, their life, and just because I think the biggest thing that we have is our relationship with our patients.
Yeah.
Because if you don't have that foundation of trust and you don't care about them, and they need to care about you, you need to care about them. That's the basics.
Right.
And if I get any red flags, if I feel we're not connecting, or if I get red flags that they're really not mentally ready for an aesthetic procedure in the office, it's good to know in the beginning.
So let me talk about a few things that I know everybody, especially even at this conference that we're talking about, things that are not going to be immediately recognized as being a successful treatment. For instance, potentially a laser treatment that's supposed to be tightening skin. Mm-hmm. And we inform the patients that it's not going to happen after the first one. How do you treat that patient to let them know, listen, here's what I think is going to be the best thing, but it may take 2, 3, 4 sessions to do it? How do you do that?
Again, it goes down to the conversation, getting to know them, what their needs are, and definitely making a plan for the whole year. And that's what everybody wants. So I literally sit down with a pen and paper, ask them what their concerns are, their main concerns. Because if you don't address their main concern from the beginning,
100%.
Yeah, right? Because
100%.
Because if you don't, they're going to say, "Oh, she just wants my money."
Right.
She just, she's just making me do all these things, but really all I wanted was lips.
That's right.
So,
Such an important thing, because I know, I'll give you, everybody that's listening, an example of that is someone that comes in that really has problems with their nasolabial folds, their smile lines. And when we start talking about lifting their cheek up to make that go away, it's actually true. But the problem is, I always tell everybody, at the end of the day, if they go home and they still see those deep nasolabial folds, they don't think they got enough of a result. So you're right. I think it is very important to address that. What are some of your favorite procedures that you do that you just love doing? So when someone comes in and you look at them and go, they're going to be a great candidate for X. What is the thing that makes you go, oh, I love doing that?
Well, first of all, neuromodulators, right? Because it's an art. There's more to it. It's not just point and shoot. I like to
I'm going to interrupt her for one second. You did a really fun thing where you injected your own face.
Oh, yeah.
Half face with two different kinds of neurotoxins, like a botulinum toxin that everybody knows about as Botox, or one of the other three. But you did do that to yourself.
I didn't do it to myself.
Well, you had somebody.
Yeah, I had somebody I trusted and injected me.
But I do remember watching each day.
I did it with all of them. I did it with all of them.
You did?
Because I wanted to really know the different personalities of all the neuromodulators.
Oh, that's fun.
Because we have 4 right now, right?
So I didn't want to interrupt you, but go ahead. So you love doing neuromodulators.
I love it. And I love teaching the patient about them too. And I talk in simple terms, like you're gonna love it. It's an opposite medicine, So I'll say.
See, that's what I'm saying. She's so good at relating to patients about what it really is. So talk about opposite. Say what that means.
If you're a patient, I would say, okay, so what's bothering you? And if you said, oh, I don't like my crow's feet.
Crow's feet.
And I would say, well, close your eyes really tight, and you would, and I would see all the little lines going like this, and I would say, now, because this muscle does this, when I do this, you're going to get a little brightening, because the opposite of this is this. Or if your frown is going down like this, the opposite is a lift and separate. And because people come in and say, oh, I need my brows lifted, can you inject all of this? Because my brows need to be lifted. And I'll explain, no, remember it's an opposite. So the job of this muscle is raise, so the opposite is fall. So
that's really good.
So I just
people really understand that. I love that.
Yeah.
What's another one of the procedures that you love to do?
I love so many. Jawline is fun.
Okay, so tell me, somebody that comes in and says, I really want that sharp jawline, what's your go-to to make that happen?
I like Voluma, but I'm excited about what's coming next. I think thicker HA fillers are going to be exciting. Like I don't know if it'll be called Volux, but in Europe they have Volux. I'm excited about that. But I think the jaw, the chin can make a big difference on people. I need mine done currently.
I think we all have to have
next takes some time.
The neck is something we were talking about a lot in the meeting.
It takes a lot of different things to get a neck, and I think that's one of those where you have to have a relationship with your patient and say, this is going to take some time. Especially like I turned 54 this year, and I find that it's getting harder to keep the neck at bay, and I haven't had facial plastic surgery yet, so I know it's going to probably happen, but I'd like to bump it off.
But see, that's the beauty of all the stuff that we keep talking about doing, and what you're doing to yourself is that you're keeping everything so in shape that it really is going to be a point where we may not even really need to a real surgical procedure in order to get the results we want.
And that'll be nice unless you're a surgeon, I suppose.
No, but that's why I stay so involved. So there's certain people that are never going to keep up with certain things, and when they walk into the office, that they need a facelift or they need their eyes done. There aren't a lot of things that we could supplant to make that happen. So I think that's true.
And healthy skin, right?
And healthy skin. Well, that's the bottom line with so much of this. Tell me about tear troughs or the underneath the lid, because I know in my practice that happens to be one of the first things that, even if they're talking about their abdomen and other things, before they walk out the door, they go, oh, you know what else bothers me? Underneath my eyes. So what are some of your go-tos for that?
It is so many different types of tear trough issues, right?
One thing doesn't solve all the problems. No, it's not a one
but sometimes people just simply need surgery for that. And I'll be honest with him, because I would want that for myself, for my family. So if it's a pretty straightforward, I like to put Voluma or Velour under the muscles, straight on the bone. And I like to go straight across and ride that orbital rim across. And then if needed, I'll put something thin like Volbella or Silk underneath the skin.
Gotcha.
But not much, like little spider webs, because you don't want that overfilled, puffy look, right?
Are you lasering that?
Oh, laser is another piece of it.
Now, are you doing that if you're separating these treatments out with a filler, and then with some sort of a skin tightening with a laser? What's your regimen?
I'd rather start with laser.
Right. Same with me. Same with me. How many
because
weeks in
healthy
between?
skin always looks better.
No matter what
always,
you do, right?
Yeah.
Even if it's a facelift,
Yeah.
if you have healthy skin, the facelift looks better. So that's true. How many weeks before you would do a filler do you do your laser underneath the eyes about?
Well, I like them to do a series of maybe BBL first if they have color issues, maybe a halo, maybe skin tight. Those are maybe RF microneedling.
Yeah.
So I just would look at their skin and make a care plan for them, and then after that treatment regime's done, then we'll talk about fillers.
Love it.
If they can afford it. Now sometimes people will say, just give me some good creams and I want, and as long as you're doing something for the skin, even a microneedling, something to stimulate the skin. But sometimes people they have a wedding coming up, they don't want to wait a year to get their skin super healthy. I'm okay to do that with them, but I'm always going to give them the best case scenario care plan.
Gotcha.
And give them what it's going to cost up front. So
that's important. So they know they can budget it. The last thing I want to hit is something that we talked a lot about at the meeting, which was threads and where we're going with threads and what they can do. What's your position on using threads?
I think that the smooth threads and the twist threads, the little simple ones that you just put in that don't have any barbs on them, those are a slam dunk. Those stimulate your collagen. They give you some structure. Right away, there's very little downtime, very little pain. No pain, but it's tolerable. Those are easy. But the other ones, I just want to give them a realistic expectation.
Do you combine a filler and the threads potentially at the same sitting?
Oh, sure.
Yeah.
Especially if I'm going to do deep fillers.
Yes.
And then superficial threads.
Gotcha.
Sometimes after Botox, they'll still have lines in their glabella. Threads are great for those. Just stick a bunch in there. It just smooths it out. It looks so good.
I'm so happy we had a chance to speak with Julie. Listen, you got to follow her. Give everybody your thing.
Jubilant.Julie. And I also have a training course online.
Oh, that's right.
Yeah, I have a Patreon, and it's also Jubilant Julie.
Love it.
So I think it's like $9 a month, and they can watch all my videos.
Oh, that's terrific. I'm happy you sent that. Yeah. All right, everybody. Thanks for listening.
Thank you.
All right. Bye-bye.
Bye. Happy poking.